Hey everyone, thanks so much for joining me on the Commercial Carrier Corner. I'm your host, Jared Taylor. Joining me today is Christopher Whaley, the Associate Professor at the Brown University School of Public Health. Christopher, how are you today?
Doing well. Thanks for having me.
I'm excited to have you on. Let's dive right in. First off, I want to kind of start with a bang here. My first question for you is really, most people know healthcare is expensive, but they don't quite know how to explain why it's so expensive. So, given that this show focuses on employer-sponsored insurance, can you explain how private insurance pays for healthcare in the simplest of terms?
Yeah, so that's something we could certainly spend all day on, but I think the high level is that it's not your employer who's paying for healthcare. The employer is essentially taking money out of yours, a worker's paycheck, and using that to provide and purchase healthcare benefits. And so it's really the worker at the end of the day who's paying for healthcare. And one of the things we really know is that the prices that employer-sponsored healthcare pays are quite higher than any other country in the world, and especially when compared to other U.S. payers such as the Medicare system. And the high prices that are paid on behalf of employer-sponsored health insurance are really the key driver on why private health insurance is so expensive in the United States.
Over the course of your career, you've conducted several studies evaluating how much private insurance pays for healthcare compared to, let's say, Medicare. Can you talk us through, one of these studies and what you found exactly?
Yeah. So if we go back over the last 2 decades, the area out of the entire U.S. economy where prices have increased the most is actually for hospital care. And in a series of studies, we've actually collected data from mainly employers and examined how much they're paying for hospital care relative to what Medicare pays. And so what we find is that on average, employers are paying prices are about 2.5 times, about 250% of what Medicare pays. And that price really is what drives a lot of the reason that employers are paying so much in healthcare.
When you talk with someone, what do you think is the thing they're most surprised about here? Obviously, you study this more than most people. What's kind of the biggest either statistic, like any type of stat or piece of information that you've come across that people are most like, I never knew that, I never would have thought that to be the case?
Yeah, so we would talk about the average price. That's 250% of Medicare, roughly. But it's not uncommon to have some hospitals that are charging prices of 4 or even 5 times what Medicare pays. And so when we've talked to employers, that's just been astounding to employers who are paying those prices. I think the other thing that's been surprising is just how much higher prices are for employers. And so, typically I think most employers think that they're getting the best prices in the market, and hear a lot about how all the work that's being done on behalf of whether it's the carriers or other providers in the healthcare ecosystem to keep spending down. But then once they see the data and see that they're paying, again, prices that are 250% of what Medicare pays, I think that astounds many employers who are paying those prices.
And you mentioned that hospitals in many cases are charging several times more. Uh, can you go into, I guess, more specifically with the hospitals, why they charge so much more typically?
Yeah, I mean, so the simple answer is because they can, and you got to think that if you're a hospital that's across the table from an insurer, to be honest, most patients don't really care what insurer they're receiving or they're enrolled in, but people care a lot about their doctor or the community hospital and maintaining access. And so that really just gives the bulk of negotiation power to providers and particular hospitals. And so what we see, both our work and the work of many others, is that hospitals have been really able to capture that negotiation power and translate that into fairly high prices.
One of your big findings is that healthcare prices are not linked to outcomes. So, what can employers, brokers, and other organizations do to address that discrepancy?
Yeah, so we pretty consistently, along with the work of others, find that there's not really a strong or if any link between hospital, in particular price and quality. And so I think the uh, distressing view of that is that, look, we're paying a lot and we're not getting value from that. But in some sense, the more optimistic view is that that's actually an opportunity. And so if we know that there's not a link between price and quality, what that means is that there are many lower priced or hospitals who are just more efficient and are able to deliver higher quality at a lower price compared to inefficient providers with high prices and low quality. And so I think for the employer, the purchaser angle, that actually is a opportunity to think about both price and quality in your market, and think about programs to increase the use of efficient providers and make sure that your population goes to those types of providers.
So, Christopher, I'm going to play devil's advocate here and say, given that Medicare is paid via taxpayer dollars and has a large population, shouldn't we expect them to pay less than private insurance does?
Yeah, so certainly, Medicare has a unique way of setting prices that's different from employers and private insurers. And I think that many employers and private insurers, frankly, want to pay or think they could even pay prices that are equivalent to Medicare rates. But I think for the employer angle, where things become a little bit more perplexing is when they see prices that are on average 2.5 times, and not that limited number of cases, 4 or 5 times what Medicare is paying. And so we know that Medicare is roughly the break-even rate for a hospital, and that's what Medicare rates are set to be. And so if you're an employer or a union or a purchaser and you're paying margins of 3 or 4 or 500%, then I think that's where they would certainly push back on that.
Well, Christopher, I want to thank you so much for joining me here today and sharing some information with us. I know this is a topic that we hear all the time. Why is it so expensive? So hearing from someone like yourself that has studied this extensively is very welcoming, and I look forward to hopefully having you come back on in the near future.
Great. Thanks for having me.